Hello, good afternoon. This is Woody Collins with Congo Helping Hands, and I am here for another episode of talking about the Congo. Let me adjust my camera a little bit, so that you can see me a little bit better. And but thank you for checking in with us today. Two things we want to talk about. Number one is Ebola, the ongoing Ebola crisis, and then we're going to talk a little bit about non-governmental organizations. So let's get to the Ebola. Ebola is still progressing in the Equatorial province. Um, it has not slowed down. They had another case today, and so it's steadily increasing. So we hope that these NGOs that went up there to help out, that they can get things together and uh, arrest this Ebola crisis that we got going on there, because we definitely don't want it to increase like it did over in the east. So at least we don't have the violence, but we have a lot spread out. But so it's going to take more manpower, and that brings us to talk about all the NGOs that's going out to help. The importance of NGOs is they are the ones that actually do things. They work with the local Ministry of Health in different areas. They provide the resources, they provide people, and they provide the necessary equipment in a lot of cases. So one of the things that we were talking with our colleague, my colleague down in, I call her a colleague, but with Hand Up Congo, that's in Australia. They are working to try to get another lab put in up in the Ebola crisis area, so that they don't have to ship the specimens down to verify that who has Ebola and who does not have Ebola, all the way down to Kinshasa, which could take up to 2 to 3 days a minimum, and even longer than that. So one of the things that we're thinking about doing is trying to get the Rotary International, which could be considered a non-governmental organization, to buy a lab and put up there, and hopefully that will cut the time down and would also speed up tracing. As we know, when people are tested, they want the results immediately, and they don't have time to sit around a clinic to determine where when and where they're going to get the next things. These clinics don't have facilities like food and all that, so they got to go home. So if they are positive, they will spread it to someone else, and then it gets spread to someone else. They may even have to go out to the field of work. So it's very crucial that we need to get them while they're in there for a test, or when they find a body that they can test that body, immediately start doing contact tracing. And that's the problem that we're having here in the United States, is that we're taking too long to do the test in some location and get the results. So by the time people get the results, they're long gone. They've infected a lot of other people. Hopefully, and I think Ebola is just about as infectious as the COVID, by coming in contact with different fluids and stuff, and it's definitely more deadly than the COVID virus. So it will spread, and those people who have Ebola, have a lethal survival rate. They don't last that long and stuff like that. So that's one of the roles of non-governmental organizations, is to support the government. They are not, just like Congo Helping Hands, we are not uh, working for the government. We work with our donors and also work with other NGOs to help get uh, the products and services that's necessary. Because especially in the Congo, their government is a very weak government, and they don't have the resources to do a lot of stuff. So if it wasn't for the non-governmental organizations in the Congo, it would be much dire situation. So just wanted to touch on those 2 points. So hopefully I'm going to hear back something from Australia so that we can determine whether we're going to start a campaign to buy a lab to put up there and also see what else the people need. So it's just critical that we got that I know of a NGO on the ground up there, and so it's easy for me to know I know those people face to face, have seen them, and know what they're all about. And it's easier for me to kind of work with somebody like that versus trying to reach out to some other people. Uh, it's just like we say here in the United States, we're all in this together, and we're definitely all in this together in the Congo because the Ebola outbreak today in the Congo is is much closer to Kinshasa, and by boat it could take a couple of days, and it could be in Kinshasa, and then all all devastating. I was going to say something else, but you can probably understand. It would be like pouring gasoline on a fire and everything. So, anyway, thank you for tuning in, and we will see you tomorrow. And hopefully, we'll have some more updates on what's going on in the Congo. Please reach out to me with your comments, questions, and we will talk with you tomorrow. Take care, be safe, and be blessed.